So a tummy tuck or an abdominoplasty basically consists of cutting off excess skin and fat, typically from the pubic bone to your belly button, and that whole roll is gone. This is performed in conjunction with sculpting liposuction that we do along the hips on each side, as much as we can get, and a lot of times of the pubic area as well. After that's done, we then make that low transverse incision, which is lower than a C-section scar. So if you've had a C-section, that scar is replaced. But the incision can vary from a mini tummy tuck just inside the hips on either side to a full tummy tuck would be from hip bone to hip bone. And each patient's different, depends on how much skin we need to excise. That dissection is carried down to the muscles. You keep your same belly button. We cut around the belly button, cut a hole in the skin, and you maintain your belly button, and we continue to lift the skin and fat off up to the ribs on the side, and or the costal margins on the side, and to your sternum in the middle. And once that's done, we tuck the skin, and that's the tummy tuck part, down, and we determine the amount of skin and fat that can be cut off. And again, that's usually from the pubic bone to the belly button and tapering off to each side. That's removed. We then tighten up your muscles because with weight gain or with pregnancy, those muscles have become stretched out. So we do a permanent stitch that brings those muscles back together and kind of creates an internal girdle and helps hold you flat. And then we close that skin incision with hundreds, if not 1,000 sutures, all in multiple layers and all absorbable stitches. That's what takes the longest with the tummy tuck. There is a drain that comes out to keep fluid from collecting underneath your skin and fat. And also we do a suturing technique that tacks that skin and fat down so that it minimizes that drainage. This surgery takes about 2.5 to 3 hours, depending on the patient. It does have at least a week recovery time, but it is outpatient. Do want you to go home and be up and around a little bit to get your blood flowing. Being active, you'll heal better, faster, sooner, just by getting your blood flowing and taking deep breaths, and it minimizes your risk of complications. But as that incision heals, people are very happy getting rid of that excess skin and fat. They do have to wear a compression garment or a Spanx type garment for several weeks, if not a couple months, to help squeeze swelling and help the body recover from that type of surgery. And their belly button, has a small circular incision around that as it's brought out through the new skin. I do several tummy tucks a week on average.